welcome everybody. Emma, you maybe want to start sharing the screen while I just explain. This is the British Computer Society Health and Care Scotland event. I'm Katie McClure, I'm current chair, and welcome along to this session. I'm delighted to have these four presenters along, or three, one is covering for somebody else. Delighted to have four presentations for you, which are from the fabulous DigiFest24, where the posters are always outstanding. They're always amazing, and we are always so surprised at the range, the variety, the depth and the breadth of them all, and the quality. And I think you'll see that in these service development presentations this evening. We've got four great ones for you. These were ranked the top ones by the review panel, and they are very much deserving of that accolade. And I think you'll see what's happened since December. They'll give you an update from there, where it's continued. But if you haven't seen or heard these before, I hope you enjoy them as much as we did at DigiFest24. So I'm going to hand over to Emma Scatterty, who is from NES. She is going to present her colleague Hilary Lowe's ePoster first, before she does her own one. So I'm going to hand over to Emma to introduce herself and Hilary.
Thank you, Katie. Hello, I'm Emma Scatterty, presenting on behalf of my colleague Hilary Lowe. We both are part of the digitally enabled workforce team, which is based within NHS Education for Scotland, and our Building Digital Skills and Leadership programme is commissioned by Scottish Government and COSLA, so all of our work falls under this particular programme. And it's there very much to do what it says on the tin. It's all about how do we build digital skills and leadership across the health and social care workforce in Scotland. And the pieces of work that I'm going to talk around on behalf of Hilary. So these pieces of work were really around how do we develop free resources and materials that organisations can really practically use to support their staff and develop those digital capabilities. So I've got three different ones to focus on. So we've got a framework, we've got our hub, and we've got the pathways. So I'll give you a little bit of an overview of all three of these and any kind of development that we've had since DigiFest as well, towards the end of last year. So hopefully you can see parts of the poster. If it's a little bit small, you can find all the detail on our website, so you can have a look at these in a much kind of easier format than a shared poster. So first of all, the digital and data capability framework. So this framework launched in July last year. We were asked by Scottish Government and COSLA to develop this. And it's what it aims to do is to help individuals to reflect on their current levels of digital capability, and to help them then plan their next steps as to the areas in which they can develop. And what it does, it sets out the minimum digital and data skills, knowledge and behaviours that are needed to work in health and social care. And you can maybe see on the picture it's split into 6 different capability areas. And within each capability area, there are a set of statements, so that people can really kind of self-assess against these statements to determine whether they are at level 1, 2, or 3 in each of these areas. And again, that's to help them to prioritise and plan the next steps for their development around digital. So in terms of updates since the end of last year, so the self-assessment tool launched in January 2025, which gives people essentially an interactive way to work through this framework. Users who do this are then provided with a record of their results, as well as lots of links to relevant and curated learning resources for them to help them either develop in the area they're in or take them up to that the next level. And both the framework and the self-assessment tool are free to access. They can be used by all roles or levels across health and social care. So the framework really is for everyone. So all roles within all types of organisations. And then kind of very much linked to this is the digital and data resource hub. And this was born from user research undertaken back in 2022, where users told us that they wanted to access digital learning in one place. I think we all knew there were loads and loads of resources out there, but that can be quite a difficult environment for people to actually navigate and find what they need. So the aim of the hub is to centralise access to free digital and data learning resources and make them easier to find and engage with. And so the hub launched in January 2024, so just over a year ago. It hosts over 300 different learning resources from lots of different external providers, all of which are free to access. And what we've done is organise those resources by framework capability area, so kind of by topic. And then these are also then subcategorised, again, to make it easy to access and find what you're looking for. And all of these resources have been quality checked by our team before they're added to the hub. And you'll see if you do go and visit the hub, we are also collecting ongoing user feedback about those resources that are on there. So there should be user ratings where we've received those, as well as things like estimated completion times. And we do update these constantly, so it's well worth kind of going back and checking, not just visiting the once. There are new things added every month, and anything that's outdated is also removed in that process. And it all sits on an open access site, so no need to log in. Again, designed to be as accessible as it possibly can be. And then the third piece at the bottom here, so this is the thriving in a digital age pathways. And essentially these are learner journeys, learner pathways. They launched in October 2024. And essentially what they are a series of resources for users to work through. They are less about the kind of techie or how-to digital skills. They're more about understanding the key concepts that you need to be aware of in relation to digital health and care. So things like digital inclusion, the value of data, what are the benefits of digital transformation, to name a few examples. And there are 4 pathways in total, and each of these are aligned to different levels of responsibility. So the first pathway is called Explore, and that's very much for anybody working in the sector. We then move to Embed, and that's more aimed at people who are responsible for managing or supporting others. There's then the Drive pathway for those with leadership responsibilities who are influencing and driving change. And then there's the Shape pathway, which is really aimed at strategic leaders and decision makers who are shaping policies, organisational strategies, and those kinds of things. And as I say, it's kind of each pathway is made up of a set of resources, and that can be something to read, to watch, to listen to. But critically, there's also a set of reflective questions to actually help you apply what you've read or seen and learned to your role in your organisation. And again, these are also updated monthly. You can sign up to receive an email notification when we update them, but that's all available on the Pathways site, and I'm sure we'll get these links shared with you. And I suppose a bit of a coming soon for the pathways. We are developing a couple more at the moment. So we've got one on cybersecurity, which is underway, and also one on AI. And these will be available later in the year. Thank you.
Thank you, Emma. That was tremendous. And you've done Hilary proud, I'm sure. Really great work from the digitally enabled workforce within NES and the wider NES group. And great to see partnership with Digital Health and Care and COSLA as well. These are amazing resources. They're tremendous. I work in the NHS as well, so I'm in and out of those too. And great to see that you actually go above and beyond. It really does cater for all the different stages of your career, and for people who move in and out of different career paths as well. So are there any in particular that are your favourites, Emma?
Oh, that is a good question. I think for myself, I think sometimes when you're kind of very much already working in this area and you kind of think, oh, I kind of know everything that's happening, I know what I need to know, but actually going away and using the framework, personally, I think was probably
Mhm.
one of the most beneficial things I've done for a while. um, and we say it is designed for anyone in any role, and it's absolutely designed for us as much as anybody else. So that'd probably be my one thing to say to go away and do. And there's a nice interactive way to do that as well now. So if you do it with the self-assessment tool, I did it pre-self-assessment tool where I was doing it on a document, but now you can do it a bit more in a more interactive way, and then just get all those resources landing in your inbox essentially to
Yeah.
go away and have a look at. But it just made me personally kind of reflect on, actually these are areas I could be developing more for, my role. So yeah, I'd say that's my favourite of those resources.
Yeah, yeah, no, tremendous, and it's up to the same high quality that we expect from NES. It's always of a high quality and worth looking through. Any questions from anyone else before we let Em off the hook? She's going to come back and do her own presentation after the other two.
Can I ask a question, Katie? Is
Yeah,
that
of
all
course
right?
you can, Nessa. Yeah.
Partly a reflection and partly a question, Emma. So thank you. That's really interesting. Just purely by chance, I was listening to a presentation earlier from a couple of folk from the EU about the EU AI Act. It's quite hard to say. It just feels like a lot
Mm.
of initials. Which the act came into play last summer, but the actual the framework around the act comes into play next year properly, but some bits of it are already in place. So the reason I'm bringing that up is because one of the kind of planks of that work and one of the areas they talked about today was around AI literacy
Mhm.
specifically. So when I was listening to you speak, I was immediately thinking about that and how challenging it can be to find resources for staff and citizens to use and access. So the reflection is just that it's really good to see that it's accessible to all roles, all staff. Second part of the reflection is the self-assessment tool, which I think you mentioned it was launched in January. I wasn't aware of that, so happy to disseminate that to our
Mm.
colleagues and contacts, which I think I would like to have a go myself. Uh, but yeah, so the question I guess that comes out of all of that is, well, it's sort of a what do you do next, really? Is it difficult to keep developing resources, or is it a case of working with whoever is out there, whether it's the Scottish AI Alliance or whomever it may be, that's appropriate to develop content? How does that bit work? Does that make sense?
Mm, yeah, absolutely. And I suppose, like, for example, a lot of the resources that currently sit on the hub, they're not things we've developed as a team. It's been about actually using what's out there and curating those resources. And I think where you're talking about, obviously, the AI literacy, I think the AI pathway is very timely and very needed. People are already dabbling in it, using it. So we need to give people the resources to kind of understand, how to use it safely and how it can be used and its potential for this sector. So yes, absolutely. And I was going to say something else on your point, but it's gone out of my head now. Um, um, Absolutely would be grateful as well. We'll share the framework with you to disseminate that further. And if my point comes back to me, I will pop it into the chat for you because it's gone completely out my head.
And actually, there may be an opportunity just selfishly to share some of that, the resources and the links to the resources internationally. I don't know if that's something people out with Scotland can even get access into, but one of the points they made earlier today on that call was about trying to develop essentially a knowledge hub for resources, and they were really strongly asking people to share. And they did make a point of saying that there were Scottish, not just me, Scottish people on the call. And even though you're not part of the EU, the framework and the Act will influence how we approach work in relation to AI and medical devices and et cetera, et cetera, et cetera. So
yeah, that would be really interesting to be linked. I know we've spoken to the we've had conversations before with the Be Well program manager who looks at the kind of European digital and green skills. So again, trying to do similar kinds of things to us is to collate resources for the workforce. And I've remembered what I was going to say, which was, you know, where you're asking about what do we kind of do next. And I think the big part of Hillary's next focus is actually really engaging with organisations about how they're implementing things like the framework and getting people together to actually collaborate and talk about how they're doing it and what's working. So I know that's very much on kind of Hillary's agenda as well.
thank you.
Brilliant. Thank you, Nessa, for the questions, and Emma, very well answered. And that sets Hilary up for a poster for DigiFest25. So very big thank you for opening for us, Emma, with Hilary's work. Stephanie, would you like to load up take over the screen, please?
Certainly will. Thank you very much.
And this is Stephanie from the Scottish Foundation for Housing Associations.
Yes, we are the National Federation of Housing Associations based here in Scotland. My name is Stephanie Elliott, and I am responsible for technology-enabled care within the housing sector. Our DigiFest poster focused upon financial wellbeing. Sorry guys, can you see, it's just disappeared from my screen. Can you see my poster okay?
Yes, I can still see it.
Yeah. Okay, perfect then. So effectively this research proposal looked at the current relationship between ourselves, SFHA, Link Housing Association and a tech for good company called Lightning Reach, with a title of Unlocking Unclaimed Aid, a Digital Response to Economic Hardship. Now this all came about through a conversation with Lightning Reach where they had identified millions of pounds worth of funding across the UK that was left untouched every year, and they couldn't necessarily find out why that was the case. Was it just that people weren't able to access it, or did they just not know that it existed? So it really began a really interesting journey for SFHA, the Tech and Housing Programme, and Link Housing. So why are we doing this and why now? So we have seen through our members' stories and our tenant experiences that rising numbers of tenants are falling into financial hardship. It is becoming harder to sustain the levels of demand, with staff becoming increasingly, burdened with the level of administrative tasks. We're not just housing providers anymore. We provide that entire wraparound holistic support all under the umbrella of tenancy sustainment. Frontline staff have reduced capacity for other responsibilities, increasing stress and reducing the overall quality of the interactions that they're having with their tenants. The objective is really to address a significant gap in unclaimed aid, offering a one-stop shop solution for individuals facing financial crisis. So we hear again and again about people having to retell their story, relive their trauma, having to jump through hoops in order to just access basic funds to help them live a basic standard of living. So what we have experienced since we launched our pilot in July is actually that the response has been overwhelming. So initially we set the criteria to reduce to narrow the list of potential partners that we could potentially have. So we really wanted to work with organisations who had over 5,000 properties, who had an internal support fund that they could administer. They had a dedicated advice service and also had a forward-thinking and innovative culture. We did understand that this was going to be a lot for an organisation to take on, especially given the level of crisis that we're facing and the emergency we're facing. So we did, after an open call, we had a roundtable discussion with 6,000 providers, and we finally agreed at panel that we would go with Link. Now, Link Housing Association has an advice service with 18 staff, dedicated debt and money service. They provide remote service delivery. They deal with over 35,000 cases each year, and they have realised a benefits gain of over 2.5 million, and they've dealt with debts of over 1.1 million. So the demand on their services is astronomical. They also have a welfare service where they review welfare benefits, income maximisation, benefit claims. They support tenants with appeals and disputes. They signpost to charitable grants, local authority grants, fuel vouchers, and also food banks. And over and above this, they also have a debt and money advice. So they also support tenants to seek debt solution. They manage financial statements. They deal with creditor debt resolution, comprehensive budgeting, affordable finance, affordable credit, and they also support tenants with repayment arrangements. Now, before I delve into the data, I should say, given our persona that we have on the poster is a male, Link Housing asked if we could have a targeted approach that focused on single men because they were chronically overrepresented at the eviction panel. And basically what the results of the eviction panel were that a lot of these cases could have been dealt with had the men engaged with support earlier on. And Link really struggled with engaging these men, and even when they did engage with these men, they would still fail to turn up for appointments. So there's a massive amount of reasons why these men have failed to turn up to these appointments or to seek support. Could be that they didn't identify themselves in any of the support that's offered, or they didn't feel comfortable or safe enough to actually come forward and admit that vulnerability. So since December, where we had said we started our pilot in July, by December we had over 180 profiles created. We are now up to 396 users. 26 of those users have created profiles and applied for support via support worker, and 370 individuals have applied via self-service. Now, this is all anonymised data, with the exception of those who come through the direct support route. It's all anonymous. So these individuals have engaged with the platform, they've engaged with Link services completely anonymously, and we can see through the data on the dashboard that they have created profiles, they have shared their experiences and circumstances, and they have been matched to support. Now, a really critical thing with the Lightning Reach portal is that it takes your profile and then runs that against all the relevant criteria for all the various grants that they have on their system. They review it regularly, monthly, for local authority grants nationwide, and they're constantly updating their charitable applications as well. User descriptions of relationship circumstances. So again, this has all been professed by the individuals coming to seek support. So this is their understanding of their own circumstances and the information that they've chosen to share. The leading reason that people are coming to seek support is their experience in isolation and loneliness, followed by bereavement, followed by relationship breakdown or divorce. They are unpaid carers. They suffer from domestic or financial abuse. And a recent one that doesn't appear on the graphs in front of you, but since we presented in December, we have seen more individuals who have been held in remand or who have just been recently released from custody. We also asked the applicants to share their housing circumstances. So the biggest one coming out of that was the need for furniture or changes to their home. So basic necessities like furniture, carpets, curtains, white goods. The second was they require support to stay in the home or in their community. Could be due to sudden change in health, sudden change in circumstances, again, relationship breakdown, bereavement, various reasons why somebody might find themselves falling upon hard times. Third is the home is unsafe or unsuitable. 4 is experiencing homelessness or they're at risk of losing their home. And number 5 is a change in living situation. Now, what we've been able to do through this analysis is, I'll just try and zoom in a little bit more for you to see, is we've started profiling the data. When we're dealing with anonymous data sets, it's very easy to lose the essence of the people who are at the other side of this anonymity, this anonymous data set. So what we've tried to do is go into the data, pull out the most common themes, the most common data points, and build that into a picture of a person. Now, we've created this persona of an individual called John, and we've sort of quote unquote called him the guy next door, because we really do want people who are engaging with our work, who are seeing the financial inclusion work that we're doing with our partners, to actually identify men in their lives or wider circles who could be in a situation similar to this. So we're trying to provide a wee bit of emotion and empathy through calling him John and referring to him as the guy next door. Now, the data set is obviously heavily skewed because of the targeted approach that we've taken by targeting men first. So we targeted single men aged 18 to 35, and then it became all single men. And then we've then opened that up to all individuals in receipt of housing benefit, and then we've then opened that up to all people of a pensionable age as well. So the data will continue to skew as things open up and more people engage with the service, but currently as it stands, we're seeing two kind of profiles coming through at the minute. The most common profile is John. He's aged between 40 and 50 years old. He is a white man, he lives in Edinburgh, he has a socially rented home and he has no children. His circumstances are that he lacks basic essentials like food and heat, and he is experiencing isolation and loneliness. He also needs furniture or home improvements to stay in his home. John is unable to work due to disability or health condition, likely related to mental health, which actually, when we asked for a breakdown of what individuals reported to be struggling with, mental health was the highest scoring within that category as well. John reports no income. He is in receipt of benefits and he does have household debt. John has requested direct financial help, so he's came onto the portal to look for grants and funds. So when we evaluated John's needs, we looked at, he really needs a stable financial support. He needs access to health services, both mental and perhaps physical. We need to improve his social connection and support networks, whether they be digitally or in person. He also needs furniture and home improvement assistance, and he needs guidance on debt management and financial literacy. His pain points are financial instability, his mental health challenges and loneliness, the lack of essential resources, and the navigational barriers in accessing help. However, the profile does present some opportunities for link housing and wider support for John by streamlining access to financial assistance, to introduce peer support or community groups, provide holistic case management, and to develop a partnership of essential resources for John. Now, on the flip side of that, our unique personas that we were seeing coming through were of an individual called Aisha, who was an ethnic minority of Asian background, who lived within East Ayrshire, who did have children, who, because of a recent marital breakup, divorce, she found herself in a sort of unstable financial climate. So she didn't actually know how to work the system at all. So she's came to Lightning Reach as a means to make it all make sense, because she doesn't know who to seek support from. So at the minute, this is the sort of individuals who we are seeing, but again, they are not making themselves known to the advice services or the housing services at Link. This has all been done anonymously and directly through the Lightning Reach portal. Now, having 370 individuals of 396 be able to come on and self-serve and actually be matched with support has alleviated a massive amount of pressure off of the frontline services of Link's advice services and housing services. And when we quoted the first numbers at DigiFest, we were only maybe live taking actual applications for about 3 to 4 months. Sorry, I've lost my train of thought there. So we were only able to demonstrate sort of, sorry.
You only had your first few months. So you're...
Yeah.
Yeah.
So effectively we'd asked Link, could you have serviced these people within the time frame? And they said, not only could we not have serviced them, we probably couldn't even have dealt with that number of phone calls. So the fact that we've been able to service these individuals, match them with support and not impact any of the staff time has been really valuable. And preliminary sort of cursory calculations have showed that we've probably saved Link in a region of around £15,000 in staff time when it comes to dealing with these particular client groups. Conscious of time, and I'd love to take any questions. So the study really highlights the crucial role that platforms like Lightning Reach can play in addressing financial hardship and also social vulnerability. The preliminary data suggests that the platform is successfully reducing barriers to financial support, particularly for those facing urgent needs such as essential items, health challenges and housing insecurity. However, it also exposes broader systemic challenges such as reliance on benefits, the high level of debt, and inadequate housing conditions, which require ongoing attention and collaboration with additional services. So none of this can be done in isolation. It all has to be a wraparound support around the individual, of which housing is a crucial part. The research also underscores the value of leveraging technology to deliver aid more efficiently, making financial support more accessible to those in crisis. By continuing to expand the platform's reach and functionality, Lightning Reach does, in our opinion, have the potential to bridge the significant gap of unclaimed financial aid, transforming how support is delivered to vulnerable populations. And with that, I will come back to the room and welcome any questions. Thank you so much for your time.
Thank you, Stephanie. That was wonderful. This poster, you won first prize in the service developments because of the impact you'd had, and the numbers you'd reached, and the level of financial assistance that you were able to gear up and get out there. But I wonder, there's still a challenge in people having access or having enough data to access digital sources and platforms like this. Are you aware of that still being an issue, or is it an alternative for people? Do they have a face-to-face they can go to as well as the digital platform?
Well, funnily enough, in more of the data that we've seen, it has been shown that digital access has been an issue for some individuals, and actually they are coming to seek support and advice to get digitally enabled. It has been a minority as yet, but we do think those who have been experiencing sort of digital exclusion for any reason have been coming through the support route, and it's actually been the support worker who's then been creating the profile and applying on their behalf. So it's definitely on our radar. It's just not peaked as one of the sort of key indicators at the moment.
We've got time for just one more question for Stephanie, if anybody'd like to ask something.
I will again, if that's
welcome,
okay.
Welcome, Nessa.
A similar question in a way, Steph. So it's about how you connect the work the Lightning Reach has been able to do with other potential routes in for people, other resources that people might use. So is there a connection through other third sector or NHS agencies? Because I think housing can be a really interesting and useful way into all kinds of potential support for people around health and care. And you know as better than I do, it's something we don't always do terribly well. Pockets of really good practice. But you know, obviously people live at home, and if you want to provide support to people, that's a really good way in. So I'm just wondering if there are connections with other agencies as well. Thanks.
Yeah, great question, Nessa. What we've actually seen is we have people who have maybe went to access some veteran support, who have then been signposted to Lightning Reach because they're also a linked tenant. They also have relationships with people like British Gas and TSB Bank. So we do have very small data sets where somebody's went in to speak to their bank about support, and because of their partnership with Lightning Reach and the fact they're a linked tenant, it's been flagged within our system. So there's multiple ways in which individuals are finding Lightning Reach, but through Link itself, as they've been sort of using targeted communications, they've been using social media quite heavily as well, and they've also been lettering and putting up posters and flyers in sort of communal spaces within their housing developments and things. So they are trying loads of different kind of routes in, but it's really only been established relationships that Lightning Reach already had, whereby we're seeing that sort of kind of secondary signposting.
Tremendous, Stephanie, thank you. Alexia, would you like to take over the screen now? Alexia is coming from Ayrshire and Arran to speak to us and has the very, very impressive results to share.
Thanks, Nessa, and thanks for having me today. Hopefully you can see my screen okay?
We can. Can you just go into slideshow? Yep.
Great.
Brilliant.
Yes.
That's it, Alexia. Go for it.
Hi, I'm Alexia Pello, Clinical Director for East Ayrshire Health and Social Care Partnership, and my presentation today is the poster that I submitted about how we attempted to tackle the capacity demand challenges in general practice using a behaviour change app called Holly Health. So our challenge locally in Ayrshire and Arran is that we've got rising rates of long-term conditions which can be caused by lifestyle factors. We have a prescribing reform challenge aiming to look at a more preventative approach rather than prescribing. We've got a capacity demand mismatch within primary care. As with other places as well, there is a real problem with access to adequate funding, and we needed to find something that was scalable, a support that could be delivered further upstream to help people stay well and prevent decline. And also we recognised that whatever our development was, that we had to meet people where they are at and be able to scale this at low cost. A local GP practice had come to us with concern about rising diagnostic rates of type 2 diabetes and non-alcoholic fatty liver disease. Both of those conditions can be related to risk factors relating to lifestyle. The current practice that we used for modelling the data had a list size of nearly 14,000 patients. They knew that 30% of their over 25s were obese, and we extrapolated that the expected monthly prescribing cost for the people with type 2 diabetes alone on maximum therapy was £113,000 per month. So we knew we had a real potential to be able to change the spend cost on prescribing at a local and at a health board level. So what we did is we launched Holly Health via the GP practices in East Ayrshire first of all, the 16 locally, and then scaled across the whole health board of 53 practices. We offered the app via text message, a face-to-face QR code during the consultation, or the GP practice websites. What the app does is does a behavioural health check for the person first, and then it's able to provide personalised habit setup depending on the person's choices. It uses daily nudging and compassionate coaching, and it has a gamified habit tracking to be able to help improve their personal habits they want to address. We're also able to track certain health outcomes if the person wants to do that, relating to mental health, wellbeing scores, blood pressure, energy levels, sleep, HbA1c levels, which is used for diabetic control, and also weight. And also that onboarding and behavioural health check is available in any language. Sorry. We felt it important to address digital inclusion as well, so we had quite a few approaches there to be able to cover this. We made sure that there were multiple entry routes, as discussed before, and we also knew that there was an easy sign-up and onboarding process which takes place on the web rather than within the app. That meant it was available for people with tablets or mobiles or on their desktop computers. The company had co-designed their processes with older adults and people who were new to using phones. And we also made sure that it was an option for people without smartphones, so that instead they could receive habit recommendations in a printable habit tracker sheet and use places such as libraries to be able to access through the desktop. In Ayrshire and Arran and within East Ayrshire, we also worked directly with our Alcohol and Drug Partnership Lived Experience team, and that app was well received when it was trialled by people that they work with. When we looked at service-wide scaling, it was November 2023 when we started this pilot with the 16 practices in East Ayrshire, and within a year we had scaled across Ayrshire and Arran to the rest of the 50 practices with the successful results. We know that the demographic of our sign-up users, the average age is 50 with an age range from 18 to over 75. The average long-term condition number at sign-up was 3, which represents that multimorbidity challenge we have across NHS Scotland as well. The prevalence of anxiety and depression was highest, with 42% of users recognising that as one of their long-term conditions, and the most prevalent user goal was weight management. For the data plan and what we were measuring, we weren't just looking at the citizens within East Ayrshire within the initial 1,600 sign-ups, but we also then had cohorts to look specifically at people using it who have type 2 diabetes and people who have non-alcoholic fatty liver disease. And then we also had a data plan to measure on a pan-Ayrshire basis when we were scaling to be able to see the differences between our 3 partnerships as well. The data insights that came from that onboarding questionnaire from the people using it helped us as well to understand what our local population in East Ayrshire was compared to the UK population. Some interesting things that I've picked out for these slides is around physical activity. So we found out that in East Ayrshire, our physical activity rates were slightly worse than the UK average, and also that our nutrition rates locally were worse than the UK average. I know that's a small percentage there to be able to read, but actually it says that 38% of people admitted to eating 1 or less piece of fruit and veg per day. So something that we could really tangibly aim to be able to improve. We also looked at sleep and energy levels, and East Ayrshire performed worse locally than the UK average as well, with 47% of people having less than 6 hours sleep per night, which can also affect cardiovascular risk. And we used the ONS for wellbeing scores as well, and recognised that wellbeing was worse locally than the UK average. When we looked at people with diabetes, there were some interesting things that came out here as well. That people with diabetes had worse physical activity than our local East Ayrshire population, but actually their fruit and vegetable intake was better than our East Ayrshire average. So it may potentially recognise that the core focus of our consultations were around nutrition with diabetes, and we weren't addressing the importance of physical activity and how they could access that. There's also sleep and energy levels were significantly worse for people with diabetes than the local population. However, the well-being was similar to the population average. Our outcomes for people with type 2 diabetes or non-alcoholic fatty liver disease were great, and we had a 21% increase in fruit and vegetable intake, which was again through the nudging through the app, which is brilliant, and 13% increase in moderate exercise. We also had a look at self-management, and 14% had increased their ability to self-manage, and there was a huge 45% reduction in GP appointment use reported by people using the app. That was after 8 weeks of using it, and we're continuing to measure now. Across Ayrshire and Arran, for the whole health board, then we looked at our outcomes, and we had an at least 10% improvement in all general health habits for people using the app, and also an increase in the personal wellbeing scores as well at 8 weeks, which is great. We've had over 5,000 patients signed up to use the app so far, and you can see the other key outcomes there include a 35% improvement in exercise, a reduction of blood pressure, which is so important as well for that preventative approach, and increase in energy levels and reduction in anxiety. They're all statistically significant ratios using the p-values of less than 0.01. For GP appointments, which was also what we were specifically keen to be able to reduce demand for the GP appointments and improve access for people to their GP, on average for all users, there was a reduction of 1.5 GP appointments per person per year. But then we had a look at high service users, which counts of people who have more than 3 GP appointments per 8 weeks. And there was a whopping 9 GP appointments per person per year saving. And when we looked at a return on investment for that, there's a potential saving of £80,000 per year, which is a really positive demonstration there. So what are our next steps? Because we want to keep being able to scale this and find the right people and the right places to use this. We're currently in the midst of a cardiovascular disease risk reduction pilot in East Ayrshire. We've also scaled it to our cardiac rehab team, who offer it to people that use their service. The pain services are offering it to people there as well. And there's a new Waiting Well initiative looking at people that are on the waiting lists at the moment, and that is being offered through those teams in Ayrshire and Arran. That's me just for now, and I'm welcome any questions.
Thank you, Alexia. I'm still gobsmacked by the results. I just find the reduction in the GP appointments astounding. And it seems to go from strength to strength as well. Are you in touch with anybody outside Ayrshire and Arran? Have you had people approach you about it?
Yeah, so one of the presentations that we did with this data was at the Realistic Medicine Conference last year. Mm-hmm. So we were approached by one of the policy advisors at Scottish Government who wanted to understand more about our prevention approaches, which has been really helpful. And with the cardiovascular disease risk reduction pilot we're doing in East Ayrshire, we're trying to align that as well with a national programme of work by the PPC team at Scottish Government. So hopefully there's real positives that come from this. And yes, I think there's potential for it to scale beyond Ayrshire now.
Amazing. How did you identify Holly Health as the ones to go with?
So Ayrshire and Arran had a prescribing reform extreme team, and there were 5 pieces of work that were looked at by the extreme team, and one of those was about prevention and early intervention. Mm-hmm. And 2 people within the extreme team there had looked for an affordable and scalable model to be able to provide options alternative to prescribing. And from the extreme team's research, and they went out and to look at what was the capable options, it was only Holly Health that fit below the procurement threshold, and that could offer something that could be scaled across the health board to avoid a prescribing or a postcode lottery for who was going to get what service. So we were mindful of all of those, and it was actually the only thing at the time that was the feasible option.
Yeah, that's tremendous, and thank goodness it was there. Have they further developed the product as you've gone on?
Yeah, they've been great to work with actually, because they have taken feedback from ourselves, and they already had business coming from PCNs within England as well. Mm-hmm. And so any update that they were doing for a different PCN, they'd keep us informed of for Ayrshire if it was something that we might want to consider adding to ours. Yeah. HbA1c measurements was something that came in after we'd procured the product that seemed interesting and really worthwhile to be able to offer people with diabetes. And also for their feedback as well, they're able to customize it and offer a slightly different questionnaires. So we're able to, now we are tracking about, are people telling us that they are reducing medications? So we're doing that in a qualitative way, getting some stories about what medications have been stopped and why. So they've been a really good supplier to work with.
That's tremendous to hear, absolutely tremendous. Would anybody else like to ask one last question to Alexia before we go back to Emma?
I know time is limited, but I just, again, probably the same point, Katie, that you made, Alexa. I'm just so impressed at the numbers and the data, and also the you didn't have time to go into in great detail, but the fact that you can look at that data in different ways and see those different elements around the population that are being served in it, Ayrshire and Arran, about nutrition and all the other elements, and the engagement and people's willingness to sign up and use it is really impressive as well. I don't suppose that ever comes without consistent support and leadership locally. So, you know, fair play, well done. It's really interesting to see it's been expanded, or there's possibility at least of it being developed in other areas.
And hopefully it's been a boost to the morale of GPs as well, and take some of the pressure off and allow you to see other patients. So fabulous. And over to Emma.
Thank you. I will just share the next poster. So hopefully that will appear on screens in just a second. So you, as part of the Building Digital Skills and Leadership programme, so we work very much off Scotland's Digital Health and Care Strategy and Delivery Plan, and it was pledged in that strategy that we would support our senior leaders, including executive and non-executive directors, to gain and further develop the skills to embed digital technology and literacy across their organisations. So this is where this piece of work came from, and what we found was, or what we felt there needed to be, was a real kind of mindset shift at senior level, including by those steering our organisations, to really see digital as something which should be embedded into everything we do, and that we are all responsible for this agenda. It's not a separate function, it's not a separate thing that sits somewhere else, but rather it's a whole way of thinking, a way of working, and a way of doing things. And so the digital mindset sessions really are focused not on individual technologies or kind of singular issues, but they're about creating a kind of shared understanding of what it means to work in a digital way, and in doing so to consider issues, challenges, opportunities through what we sometimes call a digital lens. So a bit like we probably naturally look at things through other lenses, perhaps people, finance, for example, how can we make sure that our senior leaders are also always thinking and looking at issues through a so-called digital lens? The session itself, so it's split into kind of 3 different parts. There's a pre-recorded video which anyone can go and watch. It's open access. It really kind of introduces the subject of a digital mindset. It draws on a number of case studies, and really it's about setting the scene for part 2. And part 2 is where we have that live, interactive, facilitated session, which we run over Microsoft Teams, and we bring small groups together for that session. And we've been running those in both mixed groups, but also for individual kind of boards and teams as well. And what the purpose of that part 2, and it being a small group and interactive, is it's about getting everybody involved in that conversation around digital, and by doing so, giving people that confidence and contribute to be part of that conversation. You know, when they go back into their organisations or they're sat around their own board table. And then the third element is the resources site, which is really there to kind of support this whole offer. It's got things on it such as those key strategies, there's papers, And there's video talking heads, which we've had specifically created for this audience. And it's to help people to delve into those some of those specific topics, which you know, we just can't cover in the session itself when we're talking more about the kind of culture and mindset. So, you know, there's things on there like AI, digital inclusion, information governance, and people can go and find out more, you know, about what they feel they need to know. And the session is also very much rooted in the principles of the Scottish approach to service design. So we're not trying to make everyone an expert in that approach, but it's really getting people to understand the principles and why that's so kind of key to digital, and really about challenging perhaps some of our traditional structures and governance and ways of thinking, and how we can perhaps move away from the way we might typically approach or think about digital projects, to being much more agile when we are, you know, developing new services, improving existing services, and crucially always starting with the user and understanding what problems we're trying to solve. And the content also looks at what a digitally empowered organisation actually looks like. It raises awareness of the digital maturity assessment and how this can and should be being used to identify strengths and opportunities within organisations. And of course, it very much highlights workforce skills and some of the key programmes, resources, frameworks that organisations have access to and can use to develop their workforce skills. And one of the very useful resource within it as well is a set of questions for boards and senior leaders to actually go away and ask themselves and ask of their teams. So we've had over 200 board members and senior leaders attend these sessions to date. We've had really positive feedback so far. You know, people reporting that they've got a better understanding of what a digitally empowered organisation looks like. They feel more confident communicating with peers about digital, and more confident contributing to the work of their organisation in a digital age. And that there are mixed sessions which are still available to book. We've got some really brilliant facilitators who run that part two of this session, and bring their background and expertise to the table as well. And as with all of our digitally enabled workforce resources, they're open right across the sector. So, you know, health, social care, social work, housing, charities, third sector, they're all very welcome to those mixed sessions, and those can be booked on the website, but we also invite people, if they want a specific session for their leadership team, we can arrange that for people as well, if people get in touch with us. So I will stop there. That was more concise than last time I did it.
Oh, no, it's tremendous, Emma. I mean, the premise of what you've been doing, I think it's absolutely admirable that you guys have turned it on its head. Instead of training from the down and going up, you're actually tackling the ones at the top, who very often are the ones who desperately need it. So changing mindsets there is great for all of us. It has an impact. Instead of me hogging it, would somebody else like to ask a question? I'm conscious that I tend to just jump on and.
I'm trying to keep my mouth shut this time.
No, you're not meant to keep your mouth shut. No.
No, I obviously think, well, it's not obvious at all, perhaps. From a leadership point of view, it still astonishes me how often, I'm trying to think how to word this politely, considering it's been recorded, how challenging it can be for staff to get support to do their own training and their own education and their own build their own capacity and capabilities so that they can then support their wider teams. So it's pretty fundamental stuff, I think. That's all I'm going to say.
Yeah, and I think you're right, and I suppose we're trying to tackle every level in a sense, you know, throughout the kind of range of programmes we have on offer. But yeah, we just obviously recognise it's so important to have people in those senior positions who really kind of get it. And you know, sometimes people will come to us on some of our other programmes and, you know, they can't get support for things because people still don't see it as part of their role. And obviously, you know, we're trying to say you know, everyone should be doing digital. Everyone can, you know, anyone can lead from any role. But yeah, it's obviously people need the support to do that as well. So. Oh, I think you're on mute, Katie.
Still on mute, yeah, clicking away and not working. One of the things I always say about DigiFest is it's a most wonderful networking opportunity, and to form a very supportive network as well, and to be enthused and inspired by what you see, which hopefully when people look at this recording afterwards, they will be. I'm certainly going to encourage my colleagues to look at it, because it gives us fresh ideas as well around what's happening where. Do you have comments coming back from these leaders who say that this is actually, they're keeping in touch with people in a new network?
Yeah, I mean, yeah, 100%. And I think that's what we try to foster in the leadership programs, is very much about the networking. And, you know, I wrote something recently, and it was just kind of recognizing that actually how much the leadership programs are about connecting people. And yes, people learn like how to do things and what to do, but actually who they meet is often the biggest thing that they come away with. And we do have we've got an active digital leaders network, which, you know, anyone is very welcome to join. So again, we can share some of these links if people are interested in being part of that as well.
Yeah. And Sharon's sitting there very quietly, but I'm sure one of the things he would be saying is the value of peer learning and peer support. Oh, he's thinking about coming on. Hello, Sharon.
Good evening. Apologies for being late. Really,
not at all.
I don't know what happened. I was thinking about the focus of being patient-centric. How do you bring the patient or the service user into these discussions, Emma?
Yeah, it's a very, very good question and a good point. And I suppose just where we were drawing on, obviously, like the digital mindset sessions, you know, that's the reason they draw on the, you know, the Scottish approach to service design, and that kind of question set we put to boards, but also to kind of more operational senior leaders, is really questioning in them, you know, do you actually know, you know, do you actually know what the problem is? Have you actually spoken to people? And, you know, have you reached, you know, a representative group of people? So yeah, the conversation is very much about that. And again, not just in the digital mindset sessions as well, but also at, you know, our other leadership programs, and obviously the postgraduate program delivered by the University of Edinburgh as well. It's very much about person-led, and you know, and yeah, that whole design element that comes into digital.
Absolutely. And it'd be remiss of me if I didn't point out that British Computer Society also has a large resource set for people for their CPD, and Sharon is a CPD lead at Edinburgh University as well. So lots of connections that you can all make, and we really hope you'll all come back for the next poster session for DigiFest25, because you really have done exceptionally well. You know, we're talking 49 posters this year, and you four were top in your service development area, which was the majority of the posters. Academic research was a smaller number. And it's lovely to see such amazing examples. And please continue to strive to do what you do, because you're making such an impact in so many different ways. And congratulations again. And we look forward to seeing you again. Very well done to everyone, but especially Emma for doing a double shift. And Hilary owes you a cup of coffee, I think. So with that, we'll finish. And same time next month for the academic posters. So 25th of March. And we'll do this all again, but with very different set perspectives and approaches and data sets too.